Hey nurses, I have a question for you. And if you are a preceptor or know a preceptor, please send this to them. Send this to your friends who are nurse educators, your friends who are charting documentation specialists, and anybody you know who teaches nursing school, because I'm just dying to know what's out there, what's going on, what are the practices, what are we doing out there, folks? So as far as your charting, when you're in the acute care setting, are you charting everything required? I mean, be honest, right? Are you doing about 80%, 70%? What are the things that are the most important, that are absolutely non-negotiables, that you have to get done no matter how crazy your shift is? Now, let's just assume you've got 4 patients, or 5 patients, a reasonable assignment within what we would say would be the matrices of California, right? So you've got techs, you've got help on the floor. Could be a busy shift. Of course, you could have very heavy patients. But are you doing all the stroke assessments, all the pain assessments? Are you doing all of the telestrip measurements, identification of rhythms? Let me know. And by what time in your shift are you done with your assessment? Like, is your goal, ideally, right? For me, I would literally freak out and start sweating if I did not have my charting, my assessment, my documentation, everything that I could do done by 10:30 in the morning. If I was pushing 11:30, I was really starting to stress out, because I know, one, any of my patients can be discharged at any time, so I better be ready for that. Anything could happen to my patients at any time, given the population I took care of. So I might have to transfer a patient, take a code, anything. Again, and as well, things could change. So I want to make sure that I'm charting and documenting for the current context of the care of that patient. Also, I'm curious about, when are you reviewing your orders? Because to me, that's something that you immediately do along with that assessment. Just cruise through the chart, get rid of things that don't matter anymore, that are have already been done, or duplicitous, things that are often left over after a particular order set has been DC'd. Oftentimes the little bits and pieces are left in the chart that really clutter up the orders. But let me know, what is your practice? Thanks.